When it comes to holistic medicine and ideas, pharmacist, fitness instructor, health expert, and prolific author Sherry Torkos has encyclopedic knowledge about known medicines and alternative options. Most damsels in distress today no longer need saving in North America. It's our hearts that need saving. It is my pleasure to welcome Sherry Torkos back to Studio 4 to reveal the secrets of the heart and the keys to a heart-healthy life.
Hi.
Nice to see you again.
Good to see you too. Thanks for having me.
And congratulations, because I hear you have a small babby.
I do. He's now 10 months old. He's Phoenix Alexander, and just the sweetest, happiest. You know, this has just been an extraordinary experience for me. Having this baby is life-altering. Yes.
Is he your first?
He's my first. We had fur babies prior to having the real baby. I have some little poodles at home, but Phoenix, he's just an extraordinary child, and as a mother, I just have this newfound enthusiasm and passion for what the
And I bet you
is.
had an easy pregnancy, or is that not true? Just
I
because you know so
did.
much about nutrition and exercise and all of those
and thankfully
things.
I had no morning sickness, but my pregnancy was really good. I had some backache at the end, but no morning sickness. I stayed fit and healthy throughout, and the breastfeeding helped me get my figure back, and you know, it's been great. I've really enjoyed it.
Well, congratulations.
Thank you.
And now you're out to save women's hearts.
Yes.
Well, you have been on that mission for a while.
That's right. The book, actually, we finished the manuscript before I had the baby, thankfully, when I had time to write pre-child. But my co-author, Dr. Martha Galati, and I, we went to school together in Ontario at McMaster University, and so we're longtime friends, and we had been talking over the years about the idea of collaborating on a book to educate women on heart disease. Martha specializes in preventative cardiology, and myself as a pharmacist is something I deal with on a daily basis in working with patients. Heart disease is a huge health threat for women.
Well, I was surprised to read one of the stats in here that 42% of women who have heart attacks die within 1 year.
Yes, especially when you compare that to a man. Only 24% of men who have a heart attack will die in that first year. So women are twice as likely to die after that first heart attack than a man.
I know.
So why is that?
I don't know. You know that.
I do. I know part of the answer to that.
Okay, part of the answer
Part of the answer is women often miss the early warning signs of a heart attack. You know, when we think heart attack, we think crushing chest pain. Doesn't always happen in women. It can. We can have the chest pain, but we could also have more vague symptoms like nausea, fatigue, pain in our chest, neck, or shoulder. It may not be that crushing chest pain. So we may dismiss those early signs, and we may say, it's just stress, or it's heartburn, or I just don't feel well. I'm busy taking care of the family, and I'm not going to go to the hospital right now. So we delay getting treatment. Once we do get to the emergency department, unfortunately, women are more likely to be investigated as having emotional-based symptom issues versus cardiovascular. So if you go to the emergency room and you say, I don't feel well, my neck is sore, my chest is sore, I'm fatigued, they're more likely to say, have you been depressed, are you under stress, versus investigate you as having a cardiovascular episode. So we miss some of that vital time. Even if the heart attack gets detected, women are less likely than men to receive some of the standard of care life-saving treatments, and less likely to be referred to cardiologists, and even to have some of the procedures such as the cardiac catheterization and other things that we know are very critical. So there's a lot of reasons why women are more likely than men to die.
So you have to be assertive, aggressive.
Yes.
If you're female, not just say, call 911, say, I'm sure well, maybe you're not sure. And
but
I don't want to
if you're not sure, but this is the
put
thing,
the fear into
if you
people.
have doubt, if you know your body best as a woman, if you don't feel well and something's not right, don't just let it go and say, well, I'll deal with it tomorrow or later. You need to be proactive. And if you know something's not right and you're at the emergency and the doctor's saying to you, are you stressed, or is this heartburn or whatever, if this is something new you've never had before, then you really need to push to have those proper tests done.
However, we don't want to walk around and
you don't want to be paranoid
and
no.
think, oh my gosh, my neck is stiff, or my arm hurts, I must be having cardiac arrest.
If you're out gardening, and you've got a stiff neck, that could be it. I don't want women to be paranoid, but the issue is that this is our #1 health threat. More women are going to die of heart disease than several of the leading forms of cancer that affect women, including breast cancer.
And the first symptom is sudden death.
That's
often.
right. For some folks, the first symptom that something's wrong with their heart is sudden death, because let's face it, some of the risk factors for heart disease, such as high blood pressure and high cholesterol, they're asymptomatic. A lot of people don't realize if they have high blood pressure, cholesterol. They might not feel any different.
What is high blood pressure to you?
Well, high blood pressure, anything over 140 over 90. So 140 is your systolic blood pressure, 90 is your diastolic when the heart's contracting versus relaxing. Now, the numbers are a guideline. If you have a strong family history of heart disease, if you've already had a heart attack or a stroke, then your doctor may keep things a little bit more aggressively under control.
And ideally keep it 120 over 80, but when you age, sometimes that's more difficult. When you go to the doctor, mine shoots to the moon.
Yeah, that's right. There's white coat syndrome. We sometimes get nervous when we're in the doctor's office, or we get annoyed because we've been waiting a while. Those are things that can cause your blood pressure to rise, and that's why it's important for women to, if you have high blood pressure family history, pop into the pharmacy and get it checked every now and then. There's those machines, those kiosks you can go to in a pharmacy. They're very accurate. Then you can do it when you're feeling calm and relaxed. And
I bought a machine because I even get nervous in the drugstore.
Yeah, well, there you go. And then you have one at home, and then you can do it in the comfort of your own home. Good.
Exactly. Yes. And you can take it twice if you have to.
That's right. You can take it twice. Yes.
This cholesterol, the numbers, it's all blood test, right?
Yeah, blood tests, and that's the thing again. In the book, we go through what are some of the normal ranges, and some of the guidelines differ with the U.S. and Canada. But the most important thing is to discuss the results with your doctor. Don't just have your blood test done and the doctor says you're fine. It's normal. Ask what are the numbers. Can you review the results? You might be high-end normal. And for example, if your LDL cholesterol, which is your bad cholesterol, is slightly elevated, there are a lot of things that you can do to help lower that cholesterol, some simple dietary interventions. Like some foods that I brought today, in fact. Plant sterols, which are plant-based compounds that are naturally present in some vegetables, nuts, and seeds and fruit. They're also now being fortified and added to some foods. So you're seeing there, I've got some Raconta Heart Health pasta, also Minute Maid Heartwise, brand new product out. What they have added is these Coralwise plant sterols to these foods to make them healthier and better for your heart. They can actually, studies have shown that if you add plant sterols to your diet, a certain amount, with the recommendation is 2 grams a day, that can lower your LDL by about 15% in as little as 3 weeks.
So, but the best thing to do, I'm sure, is to eat the broccoli.
Well, here's the thing, though. When it comes to plant sterols, you'd have to eat about 100 pounds of vegetables a day to get enough of them. So when it comes to plant sterols, no, I would look for the foods that are fortified with plant sterols. But when it comes to some of the other foods, like soluble fiber, certainly you can get those naturally through diet. The plant sterols, the reason Health Canada is now approving these foods is they've done enough safety data, there's efficacy data to show that these plant sterols can offer significant benefits, but higher amounts are needed than you can typically find naturally in foods, so you need to look for foods that are fortified.
How interesting.
Even the sauce that I brought, the pasta sauce, you wouldn't notice the taste difference, but it actually is fortified with these Coralwise plant sterols.
Well, it's like when they put vitamin D into milk.
Yeah,
right?
You don't taste the difference.
No, you
don't taste the difference, but it's better for you. So I think one of the tips that we talk about in the book is, you have your favorite foods, whether it's pasta sauce, orange juice, just look for some versions that are healthier because they have some fortified ingredients.
And I like the good, the bad, and the ugly part of the book, where you say, this is the good news, this is the bad news, this is how to do it. And the good doctor, Dr. Galati, has listed all the different tests, because as you know, when you get a diagnosis and they say you have to have a
nuclear stress
test, and you think, what?
What is that?
Right, and what will it do to my body, and all of that, and what are the strategies, and so there's some fine details in here about resynchronization therapy, things like that.
Yes, things that, I think it's intimidating if you go to the doctor's office and they say to you, you need to have this particular test you've never heard about. I mean, a lot of people have heard of the basic stress tests and blood pressure monitoring and cholesterol tests and Holter monitor, things like that. But if you have to have some of these more sophisticated tests and you're not familiar with it, that alone can cause stress and anxiety.
Well, it can.
So in our book, we actually outline these tests, what it involves, any potential risks, whether it's invasive or non-invasive, what are, some of the things that you might anticipate.
Sure, if you're having a multi-gated acquisition scan, you need to know what that is.
That's right. Well, the idea is we want women to be knowledgeable and to feel empowered that you know, this is what we know about heart disease. This is what we know about prevention. This is the good news is when it comes to heart disease, most of the risk factors are within our control. So even if you have a family history of heart attack or stroke, or if you yourself have had a heart attack or stroke, doesn't mean that's your destiny, that you're going to die of heart disease. There is so much that we can do from a preventative perspective.
And as you know, as you point out in here, sudden death is more likely if you're female.
Unfortunately.
Unfortunately. What about blockage, arteries? Are we the same as men?
Well, the thing is, when it comes to the physiology of a woman versus the man, we used to think that women were just smaller versions of men. And in fact, until recently, most women were excluded from clinical studies on heart disease because it was easier to study men and extrapolate the results. But now we know that there's different dynamics in our body. We respond differently in tests. The way the plaque gets laid down in our blood vessels is a little different than men. So if you do the same test on a man and a woman, you may think the woman is fine, but she could still be at risk because of the way the plaque gets deposited. And so that's why we have smaller blood vessels. The plaque may appear more smooth when it's deposited in the blood vessels, and that's why you need to go to a cardiologist to have these tests, and someone that recognizes the nuances between men and women. Right.
They did some kind of DNA test on a dummy recently, like a mummy.
A mummy.
A dummy. Yes, a dummy mummy,
dummy
whatever. And they found that there was cholesterol somehow before trans fats and junk food. I don't know.
And here's the thing with cholesterol too. When we think of high cholesterol, most of us think that's something that occurs later in life, like when we're 50, 60, or 70. Not the case. We actually start to deposit cholesterol, and plaque gets laid down in our blood vessels in the first decade of life. So if you're listening to this and you're in your teens, 20s, or 30s, you think heart disease doesn't apply to you, it does. The process begins early in life, and that's why eating the proper foods, exercise, managing stress, all of these things are critical. Sleep, yes, which in fact, lack of sleep affects women more so than men today, big surprise. Women are more sleep deprived, and it can be a more significant risk factor with respect to heart disease. Same with stress. And these are another two issues that we cover in the book, the impact of stress and lack of sleep, and just how it affects women differently than men.
I wonder why. We don't know the answer.
Well, we're starting to know the answer. Hormones is part of it. Women's roles have changed a lot today versus 20, 30, 40 years ago. We're under more stress. We're handling more with respect to careers, lifestyles, families. We're trying to multitask and juggle it and do it all. We seem to also handle stress differently. Women they internalize stress differently. It causes, of course, blood pressure, cholesterol to rise. It can trigger inflammation, clotting. And those are some of the significant risk factors for heart disease.
Well, it makes sense that we're not exactly the same. Often women have low thyroid, and I know that that's not good.
That's another factor, and one that's often misdiagnosed or underdiagnosed is
When should a female get scanned, do you think?
Well, women need to be screened for heart disease beginning at age 20.
Screened, not scanned?
Screened. I'm not saying scanned. I'm saying have your blood pressure, cholesterol checked, review your family history, and then together with your doctor you decide if specific testing needs to be done. But you know, if you ask most women, when should you be screened for heart disease? And we did ask most women this. We did a survey before we started the book. Most women think they need to be screened beginning at age 50.
Not so.
Not so.
Screen from the time you're 20, know what you're up to,
just
all
like
of that.
if you're going for a pap test, you know, that's the time you're having your annual physical. Make sure you get your blood pressure, cholesterol checked, have your thyroid checked as well. We're complex individuals, and things are interrelated, and we shouldn't just be isolating out one aspect of our health.
And boost our immune system. What about these chocolate chia seeds?
Well, you know, some of the other foods I brought, I brought some berries. You see I've got some colorful berries, some raspberries and blueberries, which are great for heart health. They help support the health of the blood vessels. But the foods that I brought, the Oasis juice and the smoothies, I brought that as an example of a good breakfast food for women. If you're busy and in a hurry, you don't have time for breakfast, the smoothies are great. They're fortified not only with the fruits and the berries, but the Oasis drinks, also these particular ones that I have, are fortified with Wellmune, which is an ingredient that helps support immune system health and reduce the harmful effects of stress on the body. It can reduce fatigue. Because a lot of women say to me, I'm too busy, I don't have time to eat breakfast or lunch. So try having a juice. Also, the Preventia cookies, high in oats, soluble fiber, dark chocolate, which a lot of women like.
Okay.
And that's a healthy snack.
Okay, and if all fails, you can chew a clove of garlic.
I brought garlic, yes. Garlic, a lot of benefits, wide range of benefits for heart health.
Very much so.
Wide range.
Thank you for doing this.
Thanks for having me.
Saving Women's Hearts, Sherry Torkos, who is a pharmacist, and Martha Gulati, who is a doctor.